Smartphone penetration in India is anywhere between 25 and 30%. As a result, an app-based contact tracing solution, while useful, faces the challenge of limited reach. The good news is everyone has a mobile phone. The solution that we are proposing uses voice and SMS over this vast network. We publish a phone number that people can call to get help if they develop symptoms like fever and cough. We track the location of the caller, and if we start seeing a higher frequency of calls from a certain area, we know that we can target that area for better screening, survey, and testing. We have a prototype that you can try out by calling 844 844 4267. Doctors on our team came up with 4 questions that you can ask someone to assess their risk of having contracted the virus. When someone develops symptoms and they call the published phone number, we ask them these 4 questions around age, symptoms, existing conditions like heart disease and diabetes, and contact with a confirmed COVID patient. For example,
अगर आपकी आयु 60 साल या उससे अधिक है तो 1 दबाएं, अन्यथा 2 दबाएं.
Based on their answers, we classify them into 3 categories. The first are people who are at COVID risk and need to be directed to the nearest COVID center. We connect them to a COVID hotline and also send them an SMS with the number for the COVID hotline. The next are people who need to isolate themselves and their progress needs to be monitored. We connect them to another hotline where they can talk to a doctor or a nurse who can help them manage their symptoms and advise them better on next steps. They are also sent an SMS with the number for the hotline and advised to call back again in 2 days. The last category are the remaining people who are okay or low risk. We encourage them to continue to take precautions and call back again in 2 days. The other advantages of this system is that it not only reduces the number of people going to the hospital, but it also reduces the risk for both the patient and the doctor. If a person has mild symptoms and is a low COVID risk, asking them to go to a hospital only increases their exposure to the virus. The solution can thus be used as both a way to reduce the load on the healthcare system, as well as an early detection system for COVID clusters. For more details, please take a look at the link in the description.